I would say two things to donors. One is you have an interest in global economic development because the economic development of Africa, of South Asia, is going to lead to global prosperity. So you have a direct interest in economic development, and health is a major driver of economic development. The second thing I would say to donors is don't forget the risks. We have polio on the edge of being eradicated. If we fail to do that, most adults in Europe and North America have no protection at all against polio. So as a society, you are going to be confronted soon, not 20 years from now, 5 years from now, with outbreaks of polio in your own countries, which will be socially and economically devastating. So there's a self-interest argument.
My message to donors, I think, will be global health investment works. We have seen evidence of that. The lives that have been saved because of that historical investments. And also, the economic benefits that have resulted because people are healthier. The survival rates from diseases that we used to think of like automatic killers have gone up so much, and we should continue to invest in that rather than actually cutting off.
Well, the short-term consequences of recent funding cuts have not hit us directly because we do not receive government funding as an organization that works with children with disabilities in Africa. But what we have seen is some of the funding cuts have affected our partner organizations. So we actually refer children, for example, to medical institutions for physical therapy services or to get HIV medication because children with disabilities are twice as likely to have HIV. And so many of the students that we're serving are actually now not able to get those HIV medications, and they're now coming to us looking for physical therapy so that we're not able to refer, which then increases the needs on us and expectations.
I am really hopeful from the conversations I'm hearing. For example, I would say in the African context, you're hearing a lot of pride in, we can do this ourselves where possible. It's almost like regenerated spirit of Pan-Africanism. You also have instances where you see more fundraising from individuals, increasing for different causes.
I think we can change from traditional modes of donor funding to funding that promotes more localization by working with the biggest influencers in the communities. And we've done that as an organization working with people with disabilities for a long time. We work with pastors, we work with local government leaders, the people that are actually going to be the most influential around making sure people understand, in our case, the value of health, the value of disability, people with disabilities, and the proper ways to actually treat them and include them in their communities. And when we do that, they come up with creative, innovative solutions that we may never have thought of as a Westerner, that they're able to implement.
So I think Christian organizations bring three strengths to the current environment. The first strength is that they have enormous trust within their communities, and therefore Christian organizations are able to mobilize communities in a way that very few others are, faith-based organizations in general. I would say the second thing is that Christian organizations have a great level of trust among partners. So if we're looking at an era of public-private partnership where potentially you have a donor, a government, one or more private sector partners, and an NGO, a faith-based organization, the faith-based organizations engender a level of trust that secular organizations often don't. I would say the third thing is that faith-based organizations are able to respond flexibly and innovatively in a way that government systems aren't. So that's more characteristic of many voluntary systems, including faith-based ones, but they're able to try things out and where they work to scale them up rapidly.